Okay, hello everyone. Good morning. In Japan now, noontime. Good afternoon. My name is Keiji Iramina, professor at Kyushu University in Japan. I'm great honor to talk about our study in the 7th RSU Research International Conference. And I really appreciate for inviting me as a keynote speaker. Today, I'd like to introduce our study about ADHD children training. Okay, these two girls played pronation and spination, which are exercise of bending elbow to 90 degrees and rotating the palm and the back of hand continuously. Both of them are 10-year-old girls. The left girl is a typically developing child, but the right girl has a developmental disorder with ADHD. As you can see, her movement is a little bit strange. That is, they can't do the coordinate movement correctly. Our previous study was to evaluate this exercise, pronation and spination, for quantitative variation of ADHD using an acceleration and angular velocity sensors. So early detection of ADHD tendency is important. And we have done this study after early detection. It needs to provide early medical treatment. Therefore, our target has shifted to the development of training method for early rehabilitation for ADHD children. So ADHD is an abbreviation of attention deficit hyperactivity disorder. It is one of the neurodevelopmental disorders that is not associated with intellectual retardation. It's difficult for children with ADHD to control their behavior and concentrate on a particular task. There are three major features in attention, impulsivity, and hyperactivity. These features prevent children from performing daily activities and learning. So it's important to detect early childhood and to give appropriate treatment and education. These are typical behavior of ADHD children. The left columns are related to symptoms of inattention, and right columns are symptoms of hyperactivity. So we focus in this study the inattention, such as careless mistakes, difficulty paying attention, difficulty with tasks that require significant mental effort, and easily distracted by stimuli and related to work or task. The major treatment for ADHD children is pharmacological treatment. For example, methylphenidate or atomoxetine, but drug treatment has a problem of side effects. In addition, it's not effective neurocognitive function. And behavior therapy usually involves behavior management, which uses a system of reward to encourage the child to try to control their ADHD. Problem with deficiency of trained mental health professional, and therapy is done only for a limited period. So effects are tough to maintain after the treatment period. Combination of both pharmacological and behavior therapy is also conducted. So recently, digital health intervention have been considered through IT technology. Smartphone applications have been developed to improve working memory and cognitive function as digital health intervention. The US FDA's approval of video games and digital therapeutics in 2020 was a milestone in DHI, digital health intervention. So it is important to find the children with such a developmental disorder at the early stage and to give appropriate care for normal development. Our target is the development of simple treatment and training system that can be done at home or school without special knowledge or skills. In this presentation, I'll introduce two types of our study. One is working memory training for improving the learning ability. The second one is video game for improving cognitive attention. So the first topic of today is the effect of working memory training on high school students. This study was conducted by a high school student who joined the research program for high school students in our university. So in this study, she gave 10 days of working memory training to her high school classmates and investigated the working memory training effect. Simply saying, working memory reflects to the ability to maintain, manipulate, and update information. Working memory model consists of a central executive component, which is a supervisory attentional controller, and two temporary storage systems. One is a phonological loop, and the other one is a visuospatial sketchpad. It is said that working memory capacity and fluid intelligence are strongly related constructs. Fluid intelligence is intelligence that acquires new information and processes and manipulates it speedily. Memorization, calculation, and intuition fall under this category. If so, does working memory training have an effect on learning ability? At previous studies about working memory, there are some reports that it is effective for mathematics, but there are some reports it's not effective for mathematics. The effect of working memory training is still not clear. These papers are example of the reported of the effect of working memory. So the purpose of this study is to examine the effect of working memory training on learning ability for high school students. We conducted the experiment in her high school. 42 second year students participated in the experiment. We divided into two groups. One was the training group, and another one was the control group. The training group took the working memory training for 9 days. The control group had no training. Before and after training, both groups took 3 assessments: mental arithmetic, dictation in English, and backward reciting. Mental arithmetic consists of addition, subtraction, and multiplication. This slide showed working memory training. In this study, dual end-back task was adopted as a working memory training. End-back is a memory test where end refers on how many previous stimuli must be remembered. Dual means that verbal auditory stimulus and spatial visual stimulus are presented at the same time. Please pay attention to the right side of the slide. As you can see, the situation. I'm sorry, maybe you can't hear the sound, so I didn't set the sound setting. So, okay, but in this time, so okay, the red circle, the position of change, and also the number of sound is announced. So the subject must remember the position of the red circle and the number of sound. So remember the position of the red circle and audio number that switch one after another in this way and compare with the position and number of the 2 to 5 periods one. Training group took 10-minute working memory training a day. In total, they took 9 trainings. This slide shows all assessment results. The left one is the result of mental arithmetic. The middle one is the result of dictation in English. And the right one is the result of backward reciting. In each assessment, the upper graph is both scores, before and after training. And the bottom graph shows the change in score point between before and after training. Although the score after training was increased in both training and control groups, there was no significant difference in score change between the training and control groups in all assessments. Since there is no significant difference overall in math assessment, we analyzed the data of each mental arithmetic in detail, as shown in the next slide. Looking at the score of each mental arithmetic, there was no significant difference between control group and training group in all kinds of arithmetic, but multiplication shows an increase the base. Multiplication is increasing shows the base. A group means a training group, B group means a control group. The increase is slightly greater in group A in multiplication. This is because multiplication is the most difficult task, and the first score was low overall. So we think that the increase in score was noticeable. We consider that there might be a possibility that the effectiveness of the training may change depending on how the ability of the subject. So we compare the difference of increase between the low performance group and high performance group in mental arithmetic tasks. We divided the participants into 2 groups. One was getting a higher score in each task, and another one was getting a lower score group. This slide shows the comparison of the difference of increase between the low performance group and the high performance group in mental arithmetic, addition, subtraction, and multiplication. The improvement in performance for both the training and control group were higher for the low performance group. Low performance group were higher than high performance group. The improvement in the performance of the low performance was greater in the training. This means the working memory training is effective for low performance group, not high performance group. High performance is not effective. So in this study, 9-day working memory training, there was no significant difference between the training group and the control in all assessment. One of the reasons for the lack of clear overall training effect was that the 9-day working memory training period was too short, we thought. Also, there was no significant difference between the training group and control. The low performance group showed a high improvement than the high performance group. We thought that working memory training is effective to improve the learning ability of low performers. So training is effective for low performing people. So working memory training is effective for not all people, just only for low performing people. The limitation of the study is the small number of experimental subjects. and short training period, we need to increase the number of subjects and to take a long period of working memory training. Okay, let's move to the next topic. The second topic is virtual reality games for attention training. This study was mainly conducted. One of my Thai students, Notapon Nakpu, she developed this training game. So recently, digital health intervention have become popular. Digital health intervention are defined as health service delivered directly through formal or informal care. With cognitive training through gaming attention over the years, more and more studies have confirmed the positive impact of game training. In 2020, a video game app, EndeavorRx, was authorized by FDA. Now you are watching now this game. This game is the treatment for kids aged 8 to 12 years old children with ADHD. It improves attention and related cognitive control process with adaptive and personalized high degree of difficulty. It's a kind of multitasking game. So our goal is this study is to develop a multitasking game similar to the EndeavorRx, which improve attentional function, but not just to develop a game, but to simultaneously measure the brain activity of the game players and elucidate the neurological basis of brain improvement in attentional function. The obtained brain activity information will be used to improve gameplay. And in the future, the brain activity information will be used as feedback to develop real-time adaptive game. To this end, the game design itself was kept simple so that brain waves and visual information can be measured simultaneously during gameplay. The game consists of a target tracking task, a color discrimination task, and multitasking game combined with target tracking task and color discrimination task. The details of the game are described next. So the target tracking task requires subject to move player to the white circle that continuously appears on the ground. The player just pressed left and right button to move player in a good timing. This is related sustained attention of the player. This is a target tracking, but in this case is very simple and easy. So in addition, this game adopts a self-adaptive staircase algorithm to adjust the difficulty. It will adjust the difficulty level of each task for the next minute based on the subject performance. It corrects the rate in the current minute. The color discrimination task appears when the color of player changes and lasts for less than 1 second. The time window changes depending on the adaptive difficulty level, and color discrimination task also ends when the subject presses the fire button. The subject is required to check whether the color of the jewel and the monster. So this is a jewel and the monster, this color and the player's color. Both of this color is the same. It's just a case of the goal. The both of the jewel and this player's color is the same. It's just a no-go trial. the color is different, it's a go task. So this is a kind of no-go task. So, okay, so this color discrimination task is a no-go task. The subject must pay attention to the change color and keep that information and push the button or don't push the button. This game has also the game difficulty level adjustment system. This game maintain the accuracy at 80%. So this is just only the color discrimination task. The player and the monster go straight. But right one is multitasking, the combination of the target tracking task and color discrimination task. So the player must pay attention to the tracking and also the changing color. So it's a multitask game. So we use a head-mount display, HTC Vive Pro, which can be recorded eye gaze data such as pupil diameter, pupil position, gaze origin, gaze direction, eye focus data. So we also recorded the EEG by using the GTEC USB amp. This one. So this system can be collected eye gaze information. This is the example of the collected data. The top one is a pupil diameter. The sampling frequency of the collecting is a 44 Hertz frequency. The second one is a gaze point. So we can know the subject watch which point, monster or player or target. So like this one, the bottom one is the gaze direction, like this one. So this is an example of a pupil diameter result. Mean pupil diameter, peak duration, and latency to peak are frequently used. Features of pupillary responses. Mean pupil diameter change was used to reflect the difference in cognitive load between groups in different time periods. The left one is the high group pupil diameter. The right one is a low level of group pupil diameter. Also, no difference in low group pupil diameter between the tasks, but between the task CDT, TTT, multitask tracking. So there are differences, significant differences between CDT, color discrimination task, and multiple tasking. So pupil diameter reflect of the concentration, cognitive load. So this multitask required the high concentrate and high cognitive load. So this is an example of the EEG data. So EEG data is recorded with some event trigger. So we can obtain this is the power spectral density, theta wave, alpha wave, beta wave, and in each task. This is the color discrimination single task. Middle one is a target tracking task. And right one is a multitask combined with target tracking and color discrimination task. So in the theta wave, PSD, so FM theta, midline theta, front midline theta is clearly appeared. This is theta, FM theta wave. So the event-related spectral perturbation topography every 40 milliseconds displayed. We can know the change of the topography every 40 milliseconds, like this one. So we can know the detailed information or brain activity by measuring of EEG, like this one. So in this color discrimination task is a kind of no-go task. So in no-go task, there are several cases. So when the go trial, it's successive, and failure, but it's the different condition, response after time limit. So we divided these cases and we obtained the ERP, event-related potential. This is an example of the event-related potential. Trial success or trial failure. The blue one is a succeeded trial. Orange one is a failure trial. So success case and failure case, the waveform is different, especially the peak amplitude and latency is a little bit different. So by analyzing this detail, we can know the different brain activity between failure case and succeeded case. And we examine the training effect of this case, but this is just trial. So only 4 days training trial. And before training and after training, after 4 days later. So we compared the performance, the assessment performance. We used 3 types of assessment performance. One is different presented sound, no-go task, and word perceptual, no-go task, and strobe task. And we evaluate the training effect using by this assessment. And we divided 4 groups. One is a multi-training group and single training group using color discrimination task and using target tracking task, and no training group we divided 4. This is the result of the assessment. This is the top one is a no-go task by sound. Middle one is a no-go task by word perception. And the bottom one is a strobe task. Basically, there are no training effect, no difference between the blue one and the red one. Just only, sorry, I didn't say, blue one is before training. The red one is after training. So this is the accuracy of the task. The left one is accuracy of the task. The right one is the reaction time of the task. So the shorter reaction time means a quick response, but just only for training effect is appear on this reaction time, multitasking. In this is the same data by recorded of the ERP, event-related potential. Blue one is before training. Orange one is after training. The waveform of ERP is different. The larger amplitude and early latency of the after training ERP that means that maybe we think this is a training effect. So the training effect is appeared in this ERP waveforms. So using our system, we can evaluate the training effect. Okay, so this is the conclusion of our system. So our objective for this VR game was to evaluate brain activity by using EEG and eye information during various events during playing game. Sorry. So, and it's possible to obtain the brain activity information in each event during playing the game using by pupil diameter, eye gaze point, power spectral density, ERP, ERSP, like EEG data. Using these data, we can investigate the brain activity during playing game. So we evaluate the training effect by using this game. So that's all. Okay, thank you very much for listening my presentation. Thank you.
Thank you, Professor. So it's time for questions. We're gonna start.
We have one question in the chat box.
Right. Yeah.
So, Dr. Gitima would like to know that in the working memory training study, you say that the training time is short period. How long does it take to train working memory in ADHD patients?
How long?
Yes, how long?
So our study was using just only 10 days, but we think it's too short. Maybe I think it needs more than 1 month or several months. But the important thing is the continuous training. So the subject can concentrate a longer time. So the performance may be increased, I think.
Okay, thank you very much, Professor, for the answer. And I have a few questions. Firstly, in your first presentation, you were talking about separating the ADHD children into the higher performance group and lower performance group. Students are Professor, in terms of the characteristic of these two groups, are there any difference that is noticeable to your eyes, like between the two groups of the high performance?
Firstly, I'm sorry, we don't use the ADHD children in our first study. This is the study of the high school student. So high school student, we divided two groups. But in the experiment result, we divided according to the score of the working memory. The upper working memory score shows the high, include the high group, and show the low working memory score, include the low performance group. So we divided two groups, and compared to that two groups, the clear difference is appeared. So we concluded only low performance case that increase the training effect.
I see. Thank you very much, Professor. This is very, very interesting. It means like memory training can help them to, getting better score. How have you done the same experiment on ADHD patients to see whether they can extend their attention capabilities? How have you done that?
Sorry, we haven't done the experiment with ADHD children. But now I want to that one, but it's so difficult to correct the subject with ADHD. That's a problem.
Okay. Do you believe that you would see the same results with the ADHD children?
Yeah, I think if we conduct the same experiment with ADHD children, it shows a great effect of working memory training. I believe that one.
And before I pass the opportunity to ask question to Dr. Jamie, I have another question. Like, will be very short, Jamie. Sorry about this. Right. Okay. I'm wondering, is it like memory training the same as muscle training? You know, when you go to a gym for performing exercise, you have to carry on doing this to get your muscle capability. Is it the same for the brain? You still have to be like under this training to get these, you know, high performance, higher attention effect.
It's an interesting question. But yeah, it's maybe I think the muscle training it also change the brain network also. So I think it's a kind of similar muscle training and working memory training. It also change the connectivity in the brain.
So
I think also, I think so.
Interesting, isn't it? It means like you have to train your brain throughout your life. Otherwise, you might lose the function of the brain. Right, Jamie, your question, please.
Thank you, Professor Iramina, for your presentation. I have two questions about your first study related to what Ajahn Sujit said. The two groups, the high-performing group and the lower-performing group, your intervention helped the lower-performing group, and I just wonder if these two groups, if they had different routines out of school, like for example, if the higher-performing group, if they were doing homework, whereas the lower-performing group was not doing homework. Maybe if the higher-performing group was doing homework, that kind of already showed the benefits, you know, like maybe the benefit of the working memory training might be saturated by them doing some extra kind of training like homework. And I wonder if you recorded the homework practices of the two groups.
You mean the whole? So sorry, I can get your question.
Oh, sorry. Okay, so
low performance, but low performance group is just, I think that it is not good at working memory, or that there are some ability to learning or something. So a little bit less performance, show less performance daily activity. So so such as student take a training, working memory, and during the training time, maybe they concentrate to the training. So their concentrate performance must be increased. Such a small, tiny thing, it changes. So low performance group is affected, but high performance group is all high performance, have their high performance for something, memory or something to do some so, but such as if the giving the training no effect, because they are already have the high performance. I think so.
Okay. And just thank you. Just one more question. I thought it was interesting. You mentioned that the pupil diameter changes with cognitive load, but also like the lighting conditions in the room, they have a strong effect on the diameter of the pupil. And I wonder how you can separate these two, you know, like, for example, if you have lighting changes in the game, maybe that can affect the pupil.
I see. It's affected by the lighting control, but in this game, we use the VR head-mount display. Maybe all cases are same condition. We don't care at such a point. Maybe just put a high mount display. Just same lighting condition for every subject, every patient.
Okay, so you just assume the lighting condition doesn't affect their pupil changes. All right.
Just during the game condition that affect the
I think
diameter.
Jamie, I think that is a fair comment though, because remember the participants, they need to wear a goggles. So that is actually a closed system. So the external light doesn't affect, but only the light coming from the game.
Yes, exactly. Yeah. So I'm thinking, like, for example, if you have more green pixels or more darker pixels than light colored pixels, that might have an effect. I'm not sure, but I just think it's maybe a consideration.
But the thing is, the game, the figure, the gameplay itself, I as the professor just played, show it to us, Jamie. They almost having like a constant light intensity anyway. That you remember the actual game.
I saw the images, but I think it would be a naive assumption to just assume that that's the case, because different colors on the screen are going to change the average light intensity. So I think there needs to be a, you know, there needs to be a very robust analysis of the effect of the light changes on the screen and the pixel changes, like maybe the average pixel intensity and the diameter of the eyes.
That's right. But I think it's solved by the analysis. But we use the baseline pupil diameter and obtain the change from the baseline. So if we decided to the clear baseline and obtain the change from the baseline, it's just only reflect the cognitive load, I think so.
Okay. It's a very interesting area. I don't know enough about it to comment any further, but thank you very much.
Thank you.
Actually, we have another questions from audience. Can you apply VR game in elderly with my cognitive function?
Pardon, sorry, I can't hear.
We have another questions. Maybe the last questions from the chat room. Can we apply VR game in elderly with my cognitive function?
Can apply VR game in elderly with my cognitive function?
Yes. So can we apply this the same?
Of course, yes.
It means just like the first stage of the Alzheimer's disease, my cognitive function impairment. What do you think your project, the VR game, can apply?
Yes, I think it's possible. Yes, I think it is very useful. But this game is very simple and easy, and the automatically level changes depend on the subject performance. So this game can be applied to any kind of people.
All right.
Okay.
Yes, thank you. It's very good research because in the patient in Thailand, the elderly people got the problem of the memory and impair the cognitive.
The mild cognitive impairment. Yes, that's important one, I think so.
But in that case, you might have to change the style of the game. You know, elderly wouldn't keen to play that sort of, you know, running speed game that like moving that fast. I don't know. You might have to go for like Sudoku or some other things. You know, I don't know.
I think so. We can say apply another game, another style to another kinds of passion as well. Very interesting. Thank you, professors.